Let's talk about a common abnormal heart rhythm called atrial fibrillation. It's fairly common. About 15% of people over age 65 will have it, though it can also occur in your younger years from a variety of causes. And it has serious implications for your health, and it can be a real bother, a real disruptor of your life. So let's talk about this common rhythm. So what is atrial fibrillation? Well, it helps to understand the heart's anatomy a little bit. So when you feel your heart beat, what you're feeling is the pumping, the contraction of the left ventricle. That's the main pumping chamber of your heart. It's very muscular because it needs the power to work against blood pressure to eject blood into the rest of the body, the brain, muscle, abdomen, legs, and elsewhere. There's also a right ventricle, very low pressure, so you don't really feel that unless you have lung disease. And then on top of the ventricles are two relatively low pressure sacs called the atria. They also contract in synchrony with the ventricles, and they add to the output of the ventricles. Now, when you have atrial fibrillation, it'll happen something like this. You're watching TV or doing something else that's relatively sedentary. You're not exercising, for instance, and you suddenly feel breathless or lightheaded, or you feel your heart racing. You may take your pulse, and it may be racing, going fast. It may even be irregular, and you want to know what's going on. If you have one of these devices that monitors heart rate, you can see if your heart rate's 120, 130, 190. The heart rate in atrial fibrillation can be very variable, but it's typically about 100 to 220 beats per minute. It varies depending on a number of factors. So you're sitting with a fast heart rate. Is it atrial fibrillation? Well, the only device I'm aware of that actually will diagnose it for you is the Cardia device. Now, I have no relationship with that device nor that company, but it's the one device that will tell you if you have atrial fibrillation. You'll see a heart rhythm generated by putting your fingers on the device, and then they have a service that you can use that will tell you whether you have atrial fibrillation or not. If you do, let's talk about what you should do. If you don't, the story does not end there. Because if you're sitting there with a heart rate, say, of 130 or 150 beats per minute, and it's not atrial fibrillation, it means something else is going on that could be quite serious, and it's still an urgent issue. So even though it's not atrial fibrillation, does not mean it's nothing. It could, for instance, be a blood clot that's gone from your pelvis to your lungs. It could be an infection, a developing infection and sepsis. And because a resting heart rate of 130 or 150 or whatever beats per minute is a sign that something very serious is going on. So don't take not atrial fibrillation as a blessing and you're fine, okay? There's still other questions to be answered. But let's say it is atrial fibrillation, or you can't tell, maybe the device is not working properly, it's giving you unclear diagnoses. You need to get to an urgent care or an emergency room. Not because the rhythm itself is that dangerous, it's because the clock is ticking. And if you allow the rhythm to go on for 24 or more hours, you risk stroke. And we'll talk about why that is. So you're breathless, your heart is racing, you're not sure what it is, you get yourself to some urgent care or emergency room where they can put you on a rhythm monitor and do an EKG. Let's assume for the moment it is indeed atrial fibrillation, a rapid and irregular heart rhythm. So when the atria generate these chaotic rhythms, it's very irregular. The normal heart rhythm is kind of regular. You don't want it to be perfectly regular. That's a conversation for another day. You want it to be somewhat irregular, but you don't want it to be rapid and wildly irregular. And that's how atrial fibrillation is. It's very rapid and tends to be wildly irregular with no discernible pattern. So you're sitting there in your emergency room on the gurney, maybe with a heart rate of 130, 190, 220 beats per minute. You're very breathless. First order of business after putting you on a rhythm monitor and getting an EKG is to slow the heart rate down. So you're going to see that there's a whole series of things they do in the emergency room or in the hospital, like in the coronary care unit, to get control of this rhythm. So first order of business after the EKG is to slow the heart rate down so that you can breathe properly and not feel so lightheaded. So they use medications, typically intravenously because it's faster, to give you faster relief. Drugs like intravenous beta blockers, like metoprolol, or an old drug called digoxin, which is still used and is quite effective, or intravenous calcium blockers like IV diltiazem. And these take a few hours and they slow your heart rate down so you finally feel, you feel better. You can breathe more comfortably, you don't feel so lightheaded, you don't feel so panicked. You may still be in atrial fibrillation, but the heart rate has been controlled. And that often means you'll be taking medications because of recurrences after the rhythm is corrected, that if you have recurrences, that you don't experience these really high heart rates. So you may be long-term on these kinds of drugs orally to make sure the heart rate does not once again go into the high range. Then you're anticoagulated. And the reason for that is there's a little sac in the left atrium called the left atrial appendage. It looks like a little ear. It's a remnant of embryonic formation of the heart. It serves no purpose. There's a number of things in the heart and the body that may or may not serve a purpose. You've heard maybe the appendix, though more recent evidence suggests it does play a purpose in the microbiome. But the left atrial appendage seems to play no important role in your health. But because it's not contracting with the atria, it's a place where blood can stagnate and form blood clots. Now, it doesn't happen right away, so it's not the first few minutes or even hours. It takes typically 24 plus hours for blood stagnation in the left atrial appendage to form blood clots. Now, the problem is those clots can break off, especially when the rhythm stops and you're converted back to normal rhythm. So that can be a stimulus for release or fragmentation of that clot, and it goes into the left atrium, then the left ventricle, where it's then ejected into other parts of your body, especially the brain, where it can cause stroke. Sadly, the strokes that come from left atrial appendage clots, or we say thrombi, tend to be catastrophic, tend to be very big, because those clots are quite sizable. They can be centimeters in diameter, and if it goes to, let's say, the middle cerebral artery in your brain, you can lose the capacity for speech, you can lose use of your body, your arms and legs, or you could die. So even though the rhythm can be controlled heart rate-wise, you're still at risk for stroke. For that reason, you're anticoagulated with a variety of different medications. Then you're typically admitted to the hospital, and steps are taken to try to convert the rhythm back to normal. Now, if it occurred just recently, if you came in really fast, they can use drugs to convert the rhythm. There's a drug called adenosine, for instance, or they can even do a cardioversion. All that means is you get sedated, they take those paddles like you see on TV, and they pass a current through your chest. Hurts a lot, so they sedate you, and it breaks the rhythm. So that's another way to do it. Sometimes it works, sometimes it doesn't. They often put you in the coronary care unit and put you on what are called antiarrhythmic medications. These are medications you likely never heard of before, but they encourage conversion back to normal rhythm. So if the cardioversion fails, they may put you on one of these drugs. It may take several days to reach what we call steady state or an effective blood level, and then repeat it again. Now, another variation in this are people who delay going to the hospital. Their heart rate's racing, they think it's going to pass, they go to bed, hope to sleep it off, and they come to the hospital several days later. Well, now it's too late to try to convert the rhythm back to normal, because the act of conversion, whether done with drugs or with cardioversion, it risks stroke. It risks breaking off that clot. And so what happens is they typically put you on an anticoagulant, a blood thinner, intravenously, and then orally for a few weeks until they know the clot has dissolved. Alternatively, some centers will do a transesophageal echocardiogram, an echocardiogram done through the esophagus, because that's the only way to see with sufficient detail what's in the left atrial appendage. If there's clot, you need weeks of anticoagulation for it to dissolve. If there's no clot, they may proceed with cardioversion. So you can see there's a lot that goes on when you have atrial fibrillation. So let's assume they successfully convert the rhythm by whatever means, right? Pharmacologic with cardioversion to the chest, and you get discharged from the hospital. You're going to be on those drugs to slow your heart rate with recurrences. You're going to be on an anticoagulant in some form. you may be on a rhythm drug to suppress recurrences. But despite all that, recurrences are the rule. Once your heart has had this tendency to show atrial fibrillation, it somehow likes to be back in atrial fibrillation. And the longer you're in it, the more your heart seems to want to be back in it. And so it's not uncommon. You go to the hospital, get hospitalized for several days, get all those things done, get discharged. 3 weeks later, 3 months later, whatever, you're back with a recurrence. They have to go through the rhythm this again. Because it's recurrent, some advocate the use of ablation. That is a catheter-based procedure that takes many hours to locate the source in the atria for these chaotic electrical rhythms, and they ablate them. They essentially kill them using a variety of methods, like extreme cold or radio waves. And sometimes it works, sometimes it doesn't. At least it seems to cut down on the risk of recurrence. So that's atrial fibrillation. In other words, it's something you don't want to have. What can you do to not have atrial fibrillation? Well, this is an evolving conversation, but I'll tell you what I think, because there's not a lot of science here. There's not a lot of well sorted out science to tell us what to do. I'll tell you what I've seen, and that needs to be better explored. But I've seen this happen over and over again. I don't know why. In my early days of the Wheat Belly series of books, where I advocated, and still do, elimination of wheat and grains for a variety of reasons, right? Because the amylopectin A causes coronary disease. The gliadin protein initiates not just celiac disease, but autoimmune diseases like rheumatoid arthritis and type 1 diabetes. The gliadin-derived opioid peptides are appetite stimulants, a long list of reasons why I advocated elimination of wheat and grains. So we did it for all those reasons, but people came to me and said, you know what, ever since I eliminated wheat in particular, I've not had recurrences of atrial fibrillation. Now, why is that? I don't know. I can speculate. Maybe it's the failure to glycate proteins, like the conduction system of your heart. Maybe it's a reduction in inflammation that is typical when you eliminate wheat and grains. But I don't know. But I've seen it over and over and over again. We've not done a formal clinical trial, but we're talking about something very benign. Certainly, in comparison to something like cardioversion or putting catheters in your heart, we're talking about very benign things, right? We're talking about a dietary change that has huge health benefits in other areas, like loss of visceral fat, reduction of blood pressure, many other benefits. And it may reduce the recurrences of atrial fibrillation. But let's be clear, reducing recurrences does not mean you've resolved the anatomic distortions in your atria, typically what's called atrial fibrosis, replacement of atrial muscle tissue with fibrotic tissue, which is essentially electrically dead or causes chaotic rhythm. So it doesn't affect that. But no one knows quite how to reduce atrial fibrosis, but I can tell you what I think helps. The diet change, that is wheat and grain elimination, and avoiding foods that raise blood glucose. Because blood glucose modifies proteins in the body. Could be in the heart, could be elsewhere. Could be in the eyes, like in the lenses of the eyes, that leads to cataracts. Could be the collagen in your skin that leads to accelerated skin aging and wrinkles. It could be the collagen in your joints, like your hips and knees, that accelerates the deterioration of cartilage and leads to arthritis. So glycation is a fundamental process behind aging and many diseases, including probably atrial fibrillation with glycation of the conduction system. So eliminating wheat and grains, dramatic reduction in blood glucose and reduces glycation. Elimination of sugar sources like soft drinks and unfermented juices also leads to reduction in blood glucose, reduced glycation. Another big factor is endotoxemia. All that means is many Americans, I think the majority of Americans, have experienced a dramatic disruption of the composition of microbes in the colon. That's where microbes are supposed to live, right in the colon, in the large bowel, the 4 to 5 feet of large bowel. But modern life, whether it's overexposure to multiple courses of antibiotics, chlorinated drinking water, food additives like preservatives and emulsifying agents, numerous factors in modern life have disrupted the composition of microbes in the colon. Now, even more remarkably, When that happens, you get the overproliferation of fecal microbes in the colon that then can ascend. It's not quite clear what causes this to happen, but they can ascend. Those colonic microbes that are overproliferated, these are species like E. coli and Salmonella and Campylobacter, then ascend into the 24 feet of small intestine. Well, the small intestine is ill-equipped to deal with this. It's very permeable naturally because that's where we absorb nutrients. But when fecal microbes, those species I mentioned, enter the small intestine, these microbes, trillions of them now, live and die. They have brief lives lasting only hours, and when they die, they release toxic compounds, specifically endotoxin, into the bloodstream. That's called endotoxemia, and that can be a major trigger for recurrences of atrial fibrillation. It doesn't cause the atrial fibrillation, it triggers recurrences. Now, I do suspect it may also be a cause by leading to atrial fibrosis, but it's clearly net science has been somewhat sorted out. That is, endotoxemia is a trigger for recurrences of atrial fibrillation. So those are two clear-cut ways to get to atrial fibrillation. Now, one of the things I warn you about is there seems to be a conversation going on in social media that you can cure atrial fibrillation by activating the parasympathetic nervous system, the brake on the heart rate, by doing such things as immersing your face in cold water or taking a deep breath and holding it and making your diaphragm go low and activate the... This is not, let's be clear, it's not a cure for atrial fibrillation. It can only occasionally work to break the recurrence, which can still be helpful. But don't interpret that to mean that it has cured. That is no such thing. This does not cure atrial fibrillation. So what I would recommend is you do all the elements of my programs, once again, where we eliminate wheat and grains and sugars. We address factors that minimize glycation and insulin resistance by doing such things as replacing nutrients missing from your life, omega-3 fatty acids, vitamin D, magnesium, and iodine. And then we address endotoxemia. And we do so using something I call SIBO yogurt, small intestinal bacterial overgrowth yogurt, based on the concept that by supplying you with microbes you've lost because of exposure to antibiotics, etc., that colonize the small intestine where this process occurs and produce bacteriocins that kill those invading fecal microbes. You reduce endotoxemia. So we've been doing this. I believe we've had some success in reducing recurrences. Keep in mind that if you have atrial fibrillation, you've likely been doing bad things to your heart for 30, 40, or 50 years, and you can't necessarily undo that harm, especially atrial fibrosis. All we can hope to do is reduce the likelihood of recurrence and maybe spare you all those nasty hospitalizations. Now, if these kinds of conversations interest you, I encourage to follow my conversations, of course, in this YouTube channel, my Defiant Health podcast, my books, of course, especially Super Gut, and if you need some guidance, some conversation about how to better engage in these kinds of strategies, the unique strategies, I invite you to join my inner circle, which is innercircle.drdavisinfinitehealth.com.